Good morning to all. I am Jaideep Pawar. Welcome to all on the behalf of Honorable Sri Baban Rao Pachpute Vichardhara Trust, Group of Institution, Krasti, College of Pharmacy. Today, our college organized a guest lecture of ophthalmic products, and today's guest lecture is Dr. Ganesh Godge. Little bit introduction about Dr. Ganesh Godge, who is presently working as assistant professor at Dr. Vittalrao Vikhe Foundation's College of Pharmacy, Viladghat, Ahmednagar. Dr. Ganesh has completed his PhD from JNTU, Hyderabad. He has more than 10 years teaching experience and he has published more than 20 research papers in reputed journals. Also, he has published 3 textbooks. Today, Dr. Ganesh Godge has delivered a guest lecture on ophthalmic products. As we know, the ophthalmic products are the part of sterile preparations. And the ophthalmic products have its own some critical importance in pharmaceutical product because of during the handling of ophthalmic product, if we touch that particular tip or contaminate that product, also hamper our eye cavity as well as some disadvantages of dosage form. Within short, Dr. Ganesh Godge will join us, so be patient. Within 2 minutes, Dr. Ganesh will join us. Due to some internet problem, Dr. Ganesh will join us within 2 minutes. So be patient. Sorry for a little bit inconvenience and for delay. Dr. Ganesh will join us within 2 minutes. Side by side, we will discuss about the today's topic, uh, ophthalmic products. As we know, ophthalmic products are the sterile products, which is free from physical, chemical, and microbiological contaminations. The definition of ophthalmic product is they are sterilized dosage forms which is designed to be instilled into the external surface of the eye or topical administrations intraocular as well as the adjacent peripheral to the eye used to congestion with the ophthalmic devices. Ganesh sir, we will join within 2 minutes. Be patient. Okay, Ganesh sir, we will join within few minutes. Due to the internet connectivity, he has some problem. Let us discuss about the ophthalmic preparations. Uh, as we know, the ophthalmic dosage form in the market, there are different forms are available. Like ophthalmic products are in a solutions, are in suspension, or ointments. But these preparations, when instilled into the eye, the formulations or preparations get rapidly drained away from the ocular cavity due to the tear flow. Because of it is a natural phenomena from our body. If any foreign particle which goes into the eye cavity, our tear flow will get trigger and that tears get ooze out from the eye cavity. And sometimes that formulation goes into the lacrimal nasal drainage also, so that when that product is instilled into the eye cavity, but the taste is appear into the our throat also because of that nasal drainage cavity. There are so many drugs which are used to treat the eye, that is particularly in case of the mitosis. An example of drug is the pilocarpine hydrochloride. Second, atropine, corticosteroids, sodium fluoresceins, tetracycline. All these some antibiotics are used to treat the eye. In anatomy physiology, you already learned about the eye cavity. Uh, in a major sense organ, eye is important one of the sense organ. It have the different parts. Important is the cornea, lens, conjunctiva, pupil, iris, sclera, choroids, optical nerve, retina. These are the some important parts of the eye cavity. And each part have its own function. Our normal volume of tear is the 7 microliter. The blinking eye can accommodate the volume up to the 30 microliter. Without that, the spillage, the drop volume is the 50 microliter. But when we are adding the external eye preparation into the eye cavity, that time that particularly volume get increased and the solution get oozed out. This is the major disadvantage of any ophthalmic product. Just wait for a few minutes. Dr. Ganesh Godge will join us shortly. Be patient. Sorry for inconvenience. Dr. Ganesh will join within a few minutes. So we will discuss about the ophthalmic products. The general consideration for the ophthalmic products are the first, it must be sterile in nature. It must be free from particulate matter also. In a sterility consideration, that free from microbiological contaminations. Because of that, if ophthalmic products is contaminated with any microorganism, that will be the hamper our eye cavity, also our vision, so that it is carefully that product is sterilized, means free from microorganisms. There are different method of sterilizations are used for the ophthalmic products. That first one is the sterile membrane filtration is used. Means under the aseptic condition, our formulations are filtered through that sterile membrane filtration. Next, but this sterile membrane filtration method is not suitable for the suspension because of suspension containing a suspending particle, and that particle will be retained on the membrane filtration, so that ophthalmic solutions are useful get sterilized by using this method, membrane filtration. For the suspension, the suitable method is the moist sterilization, that is autoclave. And for the making aseptic condition, gaseous sterilization method is also used, or ionization radiation. In case of heat sterilization, there are some drugs which are heat sensitive or particularly heat liable drugs that cannot be tolerate an increase in heat, so that those drugs which are heat sensitive, they are sterilized by using the gaseous sterilization or ionization radiation method. Meanwhile, Dr. Ganesh will join us within shortly. So, kept patience, he will join within us few minutes. Now, within a few minutes, Dr. Ganesh will join us. Uh, Meanwhile, we will discuss about the consideration of ophthalmic products. A number of requirements must be considered in the preparation of ophthalmic solution, suspension, or ointments. These consideration includes sterility, clarity, buffering capacity, and pH of the formulation. Also, consideration the isotonicity, viscosity, stability, comforts, some additives, particle size, packaging, and preservatives added. These components are also considered during the formulation of ophthalmic products. Many of these requirements are that interrelated to each other and must be considered collectively during the formulation of ophthalmic products. The buffer system must be considered with the tonicity and the comforts consideration in the mind. as we already discussed about the tonicity in parental preparations. That tonicity is nothing but to reduce the irritation or maintain the tone of the cell. Means our product must be isotonic in nature. Ophthalmic solutions are formulated to be sterile, isotonic, and buffered for the stability and comforts. A viscosity may be play the important role because of as increasing the viscosity of the product will be the hamper our vision during that product is instilled to the our eye cavity. Within 1 minute, Dr. Ganesh join us. Just 1 minute. Good morning, sir. Good morning, sir.
आवाज येतोय सर माझा?
हो सर, तुमचा आवाज येतो. हॅलो. हा सर, माझा आवाज येतोय का तुम्हाला? Due to some internet problem or connectivity, Dr. Ganesh will join us shortly. हॅलो. हॅलो.
हॅलो सर, आवाज येतो माझा?
येस सर, क्लिअर आवाज येतो.
ओके ओके.
हां सर, welcome you all, and now I am requesting Dr. Ganesh Godge to start his session on ophthalmic products. Sir, please
Okay.
share your screen.
Yes sir. Share your entire screen, na sir?
Yes sir.
स्क्रीन दिसते सर माझी?
Yes sir.
ओके ओके सर.
Please sir, start your session, and on the behalf of College of Pharmacy Kasti, I apologize to all audience for inconvenience. Now Dr.
Yes.
Ganesh sir has started his session.
Yes. Very warm good morning to one and all. Sorry for inconvenience caused. Because of connectivity, I could not join in proper time. As we all are aware, today we are going to discuss our today's point of our discussion is ophthalmic product. As per our discussion, ocular drug delivery system initially, because you all are final third year and final year student, you should audible to all. सगळ्यांना आवाज येतो माझा? हॅलो, आवाज येतोय सगळ्यांना माझा?
हो सर, तुमचा आवाज येतोय. प्लीज कंटिन्यू सर.
ओके सर, ओके. So in sterile product, we have to begin our discussion for sterile product subject right from the concept of sterility. In sterility, it is a particular stage in which there is complete absence of viable microorganism. All you must have uh, got the meaning of viable microorganism. Viable means the microorganism who have ability to cause disease. That is the concept of viable microorganism. Means sterility is a stage in which there is complete absence of viable microorganism. This particular stage in which there is complete absence of microorganism, disease causing microorganism, that is the particular stage we called as sterility, and the products are called as sterile product. Now in our sterile product subject, we have also seen several classification for sterile product, how one can classify sterile product based on their volume. We have classified our sterile product based on their volume, that is SVP, LVP, small volume parenterals, and LVP. They are abbreviated as SVP and LVP, and full form is small volume parenterals, composition 100 or less than 100 ml, and more than 100 ml is large volume parenteral as per United States of Pharmacopoeia. So apart from this small volume parenteral and large volume parenteral, there is another classification which is associated with SVP and LVP, that is other parenteral products. If you want to classify precisely sterile product, they are classified under A, B, and C. Sterile products, A means small volume parenteral, B means large volume parenteral, and C means, in short, other parenteral products. In other parenteral products, there are parenteral implants. In other parenteral products, there are formulations like transdermal drug delivery system. There are formulations like ophthalmic product. So ophthalmic products are the particular products which falls into the category of other parenteral product, and because they are classified under classification of other parenteral products, whatever quality control tests are mandatory for parenteral formulations, they are also become mandatory for our ophthalmic product, that is ocular drug delivery system. Which quality control tests are officially to be discussed or officially required for in evaluation of quality control of pharmaceutical parenteral product, that you are very much aware right now. Sterility test for pyrogen, clarity test, leakage test, all these out among them, sterility test, these are the particular tests which are required for ophthalmic products. So in short, today's our point of discussion is ophthalmic product. I discussed this point because there should not be doubt in your mind, because many times our students have doubt that ophthalmic products, they are not injected into systemic circulation, they are administered onto the surface of your ocular sac, and though why they are quality control test, whatever quality control tests are mandatory for your parenteral product, they are mandatory for ophthalmic product. What is the reason? Because they are classified under the classification of sterile product, other types of parenteral product, and because there are other types of parenteral products, mandatory quality control tests for parenteral product, they also become mandatory for ophthalmic products. So in short, what is basically concept of ophthalmic product, that one has to be very much clear with. Ophthalmic products are nothing but they are specialized dosage form designed to be instilled onto the external surface of the eye cavity or topical surface of your eye cavity. They are called, that is called as external surface of your eye, administered inside intraocular or adjacent to the eye, and that is used in conjunction with the ophthalmic device. The most commonly employed ophthalmic dosage form are solution, suspension, and ointments. That we are very much familiar since childhood. We have used solution eye drop, suspension type of eye drop, chloramphenicol ointment tube, that is required for treating the bacterial infection of your eye cavity. That is, the conventional ocular preparations are solution, suspension, or ointment type of drug delivery system, or ointment type of ophthalmic formulations. But this preparation, when instilled into the eye, are rapidly drained away from the ocular cavity due to tear flow and lacrimal or nasal drainage. That is the major drawback associated with your conventional ocular preparation. Ocular administration of drug is primarily association of drug is the most easily acceptable site for topical administration of medication. Our eye cavity, which is such a delicate organ, that is most accessible site for topical administration of medication. Ideal ophthalmic drug delivery must be able to sustain drug release. Ideal ophthalmic drug delivery must be able to sustain the drug release and remain into the vicinity of front of eye for prolonged duration of time. What is this meaning of this point? Our just now on previous slide we have seen the most commonly employed ophthalmic preparations are solution type of preparation, suspension type of eye drops, and ointment type of eye drops are available. Unless conventional ocular preparation, solution, suspension, ointment type of ophthalmic products which are available in market, they are placed into the category of conventional ocular preparation. They have many drawbacks. Like take example of solution type of ophthalmic formulation or solution type of eye drop. Many frequently we are administering such kind of conventional ocular preparation. But problem associated with solution type of eye drop is that they are unable to maintain their presence over the surface of your ocular sac for prolonged duration. And you all are aware with the anatomy and physiology of your ocular sac or organ like eye. That is that has a particular concave structure, and because whenever you instill drop, it immediately drain away from the surface of your eye cavity, and it is spillage over the surface of your cheeks. That is because the fluidity of your solutions. In case of suspension, same is the concern, and in case of ointments, that is the problem like matted eyelids, or eyelids are going to stick to the each other because of high viscosity, and blurring of vision is another concern. So very much big concern with this ophthalmic formulation is that they should give sustained action. But conventional ocular drug delivery system failed to provide such kind of sustained action. What is our requirement? That ideal ophthalmic formulation or ideal ophthalmic drug delivery must be able to sustain release, and it should remain in vicinity of front of eye for prolonged period of time. But conventional ocular preparation like solution type of, suspension type of, or ointment type of drug delivery system, they have A or B such kind of drawbacks, due to which they fail to give prolonged residence, and due to which sustained action we are not obtaining, or we are not getting sustained action from conventional ocular preparation. And that is why NODS means new ophthalmic drug delivery system are emerged into the market. As time passes in our upcoming slide, we will discuss those NODS, means new ophthalmic drug delivery system. But right now, our discussion should begin from introductory part, that is the concept of conventional ocular preparation. And conventional ocular preparation, they have advantages as well as disadvantages. And major disadvantage associated with conventional ocular preparation is their flow property. And due to this fluidity, they are unable to maintain their time of contact with the ocular surface. And because they are not maintaining their prolonged residence or residence for prolonged period of time over the surface of ocular sac, they are not getting proper penetration into the vitreous fluid, into the fluid, due to which they are not ensuring their proper viability. The newest dosage form for ophthalmic drug delivery are gel forming solutions, ocular inserts, intravitreal injections, and implants. They are called as, just now we have discussed, NODS, means new ophthalmic drug delivery system, which are known for their prolonged contact time with the surface of your ocular sac. And because time of contact is increased, penetration will increase, in turn viability and absorption will increase. Just matter of our discussion is that whatever drug delivery system we are going to instill into your ocular sac, that should ensure prolonged period of time or prolonged period of contact time with your ocular surface. The more the contact with your more the residence over the surface of your ocular sac, more is the penetration or more is the viability of your drug delivery system. And conventional ocular preparation, they are unable to maintain their prolonged residence over the surface of your ocular sac. And on the other hand side, or onto the other hand side, new NODS means new ophthalmic preparation, they ensure prolonged period of contact time, like gel forming solutions. Gel forming solutions means they are called as in situ formulations. In situ formulations means at the time of installation they are in liquid form, but whenever they communicate with the tear fluid, they convert themselves into gel consistency. And because of converting themselves into gel consistency, what is outcome? Because of gel, it is less fluidity, or it is because of its viscous nature, it remains over the surface of your ocular sac for prolonged period of time, and due to which it gets proper amount of time to percolate and to increase to allow excess amount of drug or extended period of time, because of this extended period of or prolonged contact, more amount of drug is penetrated into systemic circulation, and due to which it ensures proper amount of viability and intern absorption. Major classes of drugs which you can administer via ophthalmic route, they are miotics, mydriatics. Examples: pilocarpine hydrochloride, mydriatics atropine, cycloplegics atropine, anti-inflammatory corticosteroids, anti-infective, anti-glaucoma drug, surgical adjuvants, diagnostic drugs, anesthetics. There are various types of drug or molecules with which you can prepare ophthalmic formulations. Now, in short, let us have brief look out of anatomy and physiology of eye. Composition of eye, it contains basically 98% of water, solid 1.8%, organic elements like protein, sugar, and sodium chloride, other mineral elements, sodium, potassium, and ammonia up to 0.79%. You must have seen this kind of diagram your first year anatomy and physiology, first year pharmacy. At that time, you have one chapter like eye, in which you have gone through the anatomy and physiology of your eye. Why we are discussing? Because unless formulation and development scientists do not have knowledge of anatomy and physiology, he will not be able to prepare that particular drug release system to target that specific organ of that particular area. Say for example, if you are formulation and development scientist and in your company you have to prepare the particular formulation which is going to target superficial layer of your ocular sac, and if you don't know, or if you do not have anatomy and physiology or a PhD background of your eye, that what is the particular superficial layer of eye is called as, say for example, your company is supposed to target lens, the particular drug which you are developing, that is going to develop that is going to prevent contraction or dilation of pupil. So you don't know that location of pupil or location of lens, where exactly it is located in your ocular sac, then it is not possible for you to develop that particular drug delivery system. So the concept of formulation and development basically starts from anatomy and physiology. Say for example, if you are dealing with ophthalmic product, you should have sound knowledge of that particular. Right now we are discussing ophthalmic product, that's why we are discussing here what is anatomy and physiology of eye. Basically, the outermost layer of your ocular sac is conjunctiva, and followed by there is cornea. So basically we have to concentrate on this while dealing with ophthalmic product. There are two important points: what is conjunctiva and what is location of conjunctiva and what is location of cornea. Basically, because right after this we are going to enter into the classification of ophthalmic product. At that time we have to deal with classification of ophthalmic product in two manners. That is, ophthalmic products are classified into corneal route and non-corneal route. Corneal route and non-corneal route. Non-corneal route is called as, in vice versa, synonymously it is called as conjunctival route of administration. Means corneal route of administration and non-corneal route of administration. And non-corneal route means drug do not enter through cornea but some other way, that is the conjunctiva. So corneal route and conjunctival route, or in some book you will find classification like corneal route of administration and non-corneal route of classification. Non-corneal route of administration. So here in this slide they have mentioned where is sclera, what is iris, cornea, then pupil followed by cornea, lens exactly located to the anterior part of pupil, then conjunctiva, which is aqueous filled channel over the surface of cornea. This is your retina, optic nerve, what is the important part of your ocular eye sac, choroid, and vitreous fluid, which is located into the anterior chamber of your eye sac. So these are for some important parts of your ocular sac. Human eye, basically diameter is 23 meter. Structure comprises of three layers: outermost coat, middle layer, and inner layer. The outermost coat is clear transparent cornea and the white opaque sclera. Middle layer is iris and inner layer is retina, extension to CNS. Cornea, epithelium, it is made up of epithelium cells. Penetration of drug depends on oil water partition coefficient. Now this is cross section of your eye. we are not supposed to enter in detail of anatomy and physiology. It's just to have brief lookout of anatomy and physiology to revise our knowledge which we have learned in first year. That's why we have taken this diagram. There is presence of aqueous humor, gutters humor, lacrimal glands, which are parts of your anatomy and ocular sac. Sclera, cornea, choroid, iris, these are various parts, lens, retina and macula. In short, now because we are supposed to discuss in more detail of formulation and development aspect of ophthalmic product, so basically we have to discuss mechanism of ocular absorption. If you are going to prepare any formulation, from where it will get absorbed. Basically ophthalmic product, whenever you instill a drop of your any conventional or novel ocular preparation over the surface of your ocular sac, how it get absorbed. Basically for that there are two routes, non-corneal absorption and corneal absorption. If you want to stress out mechanism of ocular absorption, you should able to distinguish what is corneal absorption and what is non-corneal absorption. Now corneal absorption, it is straight away you can explain, or meaning of this particular word is self-explanatory, that corneal absorption means absorption of drug took place through cornea, which is outermost layer of your ocular sac. And non-corneal route absorption means it will not pass or it will not percolate through cornea, but through conjunctival route, which is outermost water-filled channel, that do not have such meaning or that do not have actual presence over the surface of cornea, because conjunctival route is nothing but it is outermost water-filled channel or which is present over the surface of your cornea. So as such, if you will take microscopic structure or microscopic TS of your ocular sac, conjunctiva do not have its location, or conjunctiva do not have its presence. It is the water-filled channel which is present outermost to the cornea. So non-corneal absorption and corneal absorption, this is mechanism. In corneal absorption, penetration across sclera and conjunctiva into intraocular tissues. Penetration across sclera and conjunctiva into intraocular tissues. Non-productive, this route is non-productive because penetrated drug is absorbed by general circulation. Because penetrated drug is absorbed by general circulation. And on to the other hand side, what is corneal absorption? Outer epithelium, rate limiting barrier. Basically it took place through outer epithelium barrier, outer epithelium surface, rate limiting barrier with pore size of 60 angstrom, only access small ionic and lipophilic molecules. What is problem associated with corneal absorption? It is only have access to the small ionic and lipophilic molecules. Whenever you are dealing with the ophthalmic product, or if you are developing ophthalmic formulations in your laboratory, at that time one has to be very much sound in physical and chemical property of our drug substance, and where physical and chemical property of your drug substance will help you to select the proper drug molecule for that particular ophthalmic formulation. Say for example, if you are going to prepare ophthalmic formulation by taking say for example any antibiotic, cephalosporin antibiotic, like say for example cefixime. But cefixime, if that do not have pore size of around 60 angstrom, that drug candidate may not be suitable for your formulation. So depending upon physical and chemical property, one has to select the particular active pharmaceutical ingredient to work into the respective area. Now, non-corneal absorption and corneal absorption, these are prominent mechanism for ocular absorption. What seen or discuss in brief, fate of ocular formulation, ocular drug delivery system or ocular formulations. So students are unaware with the fate of ocular. Fate means whenever you instill drop of formulation over the surface of your ocular sac, how that particular drop of drug percolates and took that drug molecule, active ingredient, into systemic circulation. That is the fate of ocular drug delivery. So overall, this chart which is present in front of you in this slide, that is in short called as fate of ocular drug delivery. In short, it is general pathway of ocular absorption. Here in It starts with drug in tear fluid. Whenever you instill one drop of ocular eye form, say for example solution eye drop over the surface of your ocular sac, drug got its presence or drug becomes available into the tear fluid, because whenever you instill one drop, immediately tear secretions are triggered. That is the inbuilt mechanism available in our eye. That is, whenever you instill one drop of our formulation, one drop of solution type of eye drop, immediately tear secretions are triggered and drug is getting diluted with your tear fluid, and it is now available over the surface of your ocular sac. Now the matter of question is that for how much duration that formulation or that drug in tear fluid remains in associated with your ocular sac. The prolonged duration prolong with the viability or prolong with the absorption. But in case of conventional ocular preparation, they fail to maintain this prolonged period of contact time. They rapidly drain away from the surface of your ocular sac due to its concave nature. Moreover, because of their flow property, and due to which they fail to ensure proper kind of viability, required viability due to their less contact time. Now, in novel ocular drug delivery system means NODS, we are developing such kind of ophthalmic product which remain over the surface of your ocular sac for prolonged period of time with gel or in situ gel formulations, neosomes, liposomes, nanoparticles, whatever new techniques are available. With those, we are going to attempt or we are going to increase prolonged period of contact time over the surface of ocular sac. Thereby, it ensure proper viability as well as improved absorption of that particular drug. So here drug becomes available in tear fluid. After that, there is ocular absorption. Now mechanisms we have just now learned, either it will enter through corneal route or non-corneal route. Ocular absorption 5% of dose, then corneal route, and here is conjunctival route. So 1% of route or small lipophilic drugs will enter through corneal route, less than 60 Armstrong, and conjunctiva, large hydrophilic drugs, they enter through conjunctival route. So whenever drug becomes available in tear fluid, there is ocular absorption triggered. That will be triggered by either mechanism, by corneal or non-corneal route. Corneal route is that is capacity limited. Small particles they can enter, lipophilic drugs they can enter through this corneal route, and non-corneal or conjunctival route or scleral route, through those large molecules or hydrophilic drugs they can enter. In case of corneal route, after that percolation of drug, it enters into the aqueous humor, then it interacts with ocular tissue and thereby it gives it systemic response. In case of conjunctival route, whenever these molecules enter, they will give their systemic absorption. Major routes are giving systemic absorption via conjunctival route or nose. Minor routes are through lacrimal drainage, pharynx, gastrointestinal tract, skin, aqueous humor. If you are very much sound in anatomy and physiology, you must have seen uh, besides your eyelids, there is nasolabial gland,
Dear participants, due to the internet connectivity, sir will join us shortly. Kept patience, sir will join shortly.
येतो सर आवाज? हॅलो. हॅलो.
सर स्क्रीन विजिबल आहे
आहे
तुमची,
ना?
आवाज पण
आवाज
येतोय.
येतोय सर आता?
येस सर. येस सर,
ओके.
येस सर. काइंडली शेअर युअर
ओके.
स्क्रीन. हां, स्टार्ट
ओके.
युअर सर प्रेझेंटेशन.
So in previous,
सर
up till now we have seen what is
प्रेझेंटेशन
concept of ophthalmic product,
येस.
including anatomy and physiological background. We have seen mechanisms of drug absorption. Mechanism of drug absorption via ophthalmic route. One is corneal route and another is non-corneal route. After that, we have seen several layers of your ocular sac in anatomy and physiology. Ocular administration of drug is primarily associated with the need to treat ophthalmic diseases. What for ophthalmic formulations are emerged into the market? Basically, uh, up till now, whatever discussion we have discussed, that is, if anybody has doubt in that particular discussion, you can interrupt me and you can ask me immediately. If anybody has any doubt in discussion, during discussion, you can interrupt me. You can raise your voice and you can ask me some questions if you have that, regarding that particular topic which we are discussing. So far we have discussed anatomy and physiology of your ocular sac. After that, we have seen several layers of your ocular sac. After that, we have seen mechanisms of drug absorption. After mechanism of absorption, we have seen what is fate of ocular drug delivery. How drug enters from tear fluid or over the surface of your ocular sac. Whenever you instill one drop of drug, how it enters via corneal route and non-corneal, that is conjunctival route, and how you will get systemic response of that particular drug. And excess amount of drug either gets spillage over the surface of your cheeks, that is extremely waste, but whatever drug via lacrimal canalically enters into the nostril, that do not appear as waste, this that enters into systemic circulation or that shows its therapeutic action, but instead of ophthalmic route, it shows via nasal route. That is called as nasolacrimal drainage. Up till now, we have discussed these many points. Now, what is concept of ophthalmic product, or what for basically they are needed? Ophthalmic products are needed to treat ophthalmic diseases. Now you may think that if there is bacterial antibacterial infection or bacterial infection to your ocular sac, then you have oral drug delivery system or oral antibiotic preparation. What is need of development of ophthalmic product? That question may be there in your mind. That what is basically rationale for development of ophthalmic product, though oral antibiotics or oral formulations are available to treat that particular infection. Say for example, if you are having irritation of due to redness of eye, if you have irritation at the site of eye, or you are suffering pain at the site of your eye sac, and oral painkillers are available. If you have bacterial infection of your ocular sac, that is conjunctivitis, त्याला आपण डोळे आले असं म्हणतो. If you are suffering from that kind of infection, bacterial infection, you have oral antibiotics. So what is that concept, or what is rationale for development of ophthalmic product? The point is that if you will take oral antibiotics, due to first pass metabolism or due to sparing solubility, the amount of drug that reaches to systemic circulation, that is highly questionable. Moreover, it took extended period of time to develop to send that particular drug towards the actual inflammatory organ, that is your eye. You are taking oral antibiotic that will reach in stomach. It will first burst. It will generate granules. Granules will then burst to generate fine particles. Fine particle then communicate with GI fluid. Then solution of drug will be available. Then there will be absorption, distribution. After distribution, will reach to the inflammatory organ. It took extended period of time to show viability, or onset of action is very much delayed in case of oral drug delivery system, which can also treat bacterial infection associated with your ocular sac. And to overcome this problem area, we have developed ophthalmic formulations to treat this particular ophthalmic infection, or that is more specifically called as site-specific drug delivery system. Wherever infection is present, at that particular location, you have to make available your drug, so that absorption, thereby immediate action of your drug can be witnessed by your body. That is the concept of ophthalmic product. Hope you understand this point, because many times students have doubt that instead of development of ophthalmic formulation, why can't we treat that particular formulation with your oral antibiotics or oral painkillers or whatever oral antibiotic, oral solid drug delivery systems are available so far. No doubt we can treat, but the point of discussion is that in how much effective manner you can treat that infection. If you want effective administration of drug or effective recovery from that particular dosage form, then you have to reach to the site specific level. And ophthalmic formulations, they are one type of site specific drug delivery system. Wherever infection is present, at that location you are going to pinch off your drug. So the point of reaching drug or extended period of time which is required for oral antibiotics to reach up to the required location, that delay you can overcome or that delay you can bypass by development of ophthalmic product. So ocular administration of drug is primarily associated with the need to treat ophthalmic disease. Now, eye is the most easily accessible site for topical administration of medication. Ideal ophthalmic drug delivery must be able to sustain. Ideal ophthalmic drug delivery must be able to sustain the drug release and to remain the vicinity of the front of the eye for prolonged period of time. That point we have discussed in our previous discussion also, that more the prolonged period of contact time over the surface of ocular sac, more is the extended period your formulation is getting to percolate and ensure its viability in terms of its absorption. Composition of eye that we have earlier seen, anatomy and physiology we have seen, mechanism, non-corneal absorption and corneal absorption. Now, factors affecting intraocular viability. What are several factors which prevents good viability of your formulation in case of ophthalmic formulation? Inflow and outflow of lacrimal fluid. Inflow and outflow of your lacrimal fluid. Inflow means whenever you instill one drop of your ocular formulation or solution type of eye drop, immediately tear fluids are secreted. That is inflow. Inflow, and that dilutes your drug. And outflow, whenever your eye sac is very much capacity limited for area, not more than 30 microliter drug can have its presence over the surface of your ocular sac. And one drop of your drug, one drop of your ocular solution type of eye drop, that is more than 70 microliters. Try to remember this concept or try to understand this scenario. If you are going to instill one drop from your eye drop bottle over the surface of your ocular sac, that contributes around 30 microliters. That contributes around, that contributes around 70 microliter. And capacity of your ocular sac is not to accommodate more than 30 microliters of formulation. So due to which what happens, 30 and 70, that is very mismatching proportion. Excess amount of drug that has to pass somewhere. If you are going to instill one drop of your solution type of eye drop over the surface of your ocular sac, and that one drop nearly contributes about 70 microliters, but capacity of your ocular sac is to accommodate only 30 microliters of drug, excess 40 microliter pass somewhere. So some amount of drug will pass over the surface of your while administering ocular preparation, you are lying down on bed. Some amount of drug is passage over the surface of your cheek, and some amount of drug enters through nasolacrimal canalically into nostrils, that is lacrimal drainage. So inflow and outflow of your lacrimal fluid, that is the one of the factor which prevent the factor which is affect the viability of your formulation. How it affects? Due to inflow of tear fluid, drug 30 microliter which you are going to instill, that immediately becomes diluted. More the proportion, because of that it becomes more than 70 microliter. So its spillage over the surface of cheeks, some amount enters into nostrils. So very much wastage of drug is possible due to inflow and outflow of lacrimal fluid. Second, affecting viability is efficient nasolacrimal drainage. Through lacrimal canalically it enters into the nostrils. Interaction of drug with proteins of lacrimal fluid, dilution with tears, corneal barriers, and active ion transport at the surface of cornea. They are very much prominent factor affecting intraocular viability. Now, barriers avoiding drug delivery. What are several barriers that prevents drug delivery? So that we have seen, whenever drug becomes available in tear fluid, ocular absorption takes place either by corneal route or conjunctival route. Corneal route, or conjunctival route, which is also called as non-corneal route, and thereby it enters into systemic circulation. Okay, and then you will get effect of that particular formulation, and thereby it reaches to elimination. So this chart you try to remember to discuss fate of ocular drug delivery. Fate of ocular drug delivery means, in short, you have to discuss what is scenario happen whenever you instill one drop of drug. It starts, there is starting of ocular absorption. Mechanism of absorptions are either corneal absorption or non-corneal absorption, that is conjunctival absorption. Through corneal route, it enters in aqueous humor, thereby systemic absorption is triggered. In conjunctival route, it interacts with ocular tissue and thereby it gives systemic response. After that, it gives to elimination. Now, ophthalmic dosage form. After mechanism of absorption, straight away we'll discuss our dosage form, because most prominently, most precisely in examination, they will ask you about dosage forms. What are ophthalmic, write short note on various ophthalmic dosage form, either conventional or new ophthalmic drug delivery systems. Many times they may ask to differentiate between conventional ocular preparation and novel ocular preparation or new ocular preparation. So in those cases, you should be able to write couple of differentiating points of conventional ocular preparation and new ocular preparation, that is NODS. NODS stands for new ophthalmic drug delivery systems. Okay. Ophthalmic preparations are sterile products. सर आवाज येतोय माझा? हॅलो 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 आवाज येतोय ना सर? In case of ophthalmic formulations, ophthalmic dosage forms are, ophthalmic preparations are sterile product essentially free from foreign particles. Ophthalmic preparations are sterile products essentially free from foreign particles, suitably compounded and packaged for instillation into eye. The following dosage form have been developed to ophthalmic drugs. Some are in common use, some are merely experimental, and those are not for longer use. Now, in case of ocular drug delivery system, you can see conventional ocular preparation summarized in this slide. Conventional ocular preparation like solution eye drop, suspension eye drop, emulsion eye drop, ointments, inserts and gels. They are called as conventional ocular preparations. And conventional ocular preparation, let me revise in short: solution eye drop, suspension eye drop, emulsion eye drop, ointment eye drops, inserts and gels. Now, if you want to bifurcate, or if you want to distinguish, if you want to write some distinguishing features of conventional and new ocular preparation, these are conventional ocular preparations and rest all are new ocular preparations. So you should be able to write distinguishing points of drawbacks of conventional ocular preparations and some advantages of new ocular preparations, including controlled release, particulate drug delivery system or vesicular drug delivery system, which are recommended for ocular preparation or ocular penetration. So in conventional ocular preparation, you are very much aware that solution eye drop, they have some drawbacks. Due to their flow property, they are unable to maintain prolonged period of contact time. They rapidly drain away from the surface of your ocular sac. In case of suspension, they are biphasic mixtures. In those cases, again, due to their flow property, they again drain away from the surface of your ocular sac. Moreover, particles which are artificially dissolved, suspensions are biphasic dosage form, and in those cases, the drug which is present in that particular formulation, which is artificially suspended, that has some sort, that causes sometimes irritation to your ocular sac. In case of emulsion, it is again biphasic mixture in which oil and water composition is present, and due to which blurring of vision is quite possible. And due to that blurring of vision, emulsion eye drops also, they are problematic to administer. In case of ointments, again, because of their viscosity, you can increase prolonged period of contact time, due to which extensive viability can be possible with ointment type of ocular preparation. But due to enhanced viscosity, apart from enhanced viscosity, they have problem like matted eyelids. Matted eyelids here, I mean, because of viscosity, eyelids are going to stick to each other. and due to which what happens, if your eyelids are going to stick to each other, visuality or cosmetic appearance is altered, and due to which these ointmental preparation, they are also have some advantages as well as some problem areas, that is disadvantages. Now ocular inserts like implants or ocular inserts like your ocuserts and gels, they are also have some sort of blurring of vision, due to which it is quite problematic for conventional problematic to deal with conventional ocular preparations, and due to which NODS means new ocular drug delivery systems are emerged into the market. Now, which are several examples of new ocular drug delivery system, like controlled drug delivery release or controlled release preparations. Controlled release preparation in case of ophthalmic products are implants, hydrogels. Hydrogels means they contains polymers which swells in contact with the aqueous fluid, and due to that swelling, they become viscous and they remain in contact with your ocular sac for prolonged duration. And in previous slide, we have started our discussion: more the contact time, more is the viability, more is the absorption. And that problem associated with conventional ocular preparation is that they are not going to maintain over the surface their presence over the surface of your ocular sac for prolonged duration. That is the problem associated with your ocular sac. So implants followed by hydrogels, dendrimers, iontophoresis, collagen shields, contact lenses. They are examples of controlled release ophthalmic formulations. Advanced ocular preparations, particulate ocular preparations, and vesicular like liposome, neosome, deosomes, pharmacosomes. They are the examples of ocular drug delivery systems. Now, selected types of ocular drug delivery systems are aqueous eye drop, ocular conventional drug delivery system are aqueous eye drop, oily eye drop, eye ointment, and eye lotions. आवाज येतोय सर माझा? Hello, students, you are
Yes,
getting
sir.
my voice?
Yes, sir.
Am
Yes,
I
sir.
audible? Okay, no problem. Several examples of ocular preparation, ocular control drug delivery systems are in front of you. Ocular conventional delivery system, eye drops, oily eye drops, eye ointments, eye lotions, paper strips, ocuserts, hydrogel, contact lenses, collagen shields, and ophthalmic rods. They are examples of ocular control release drug delivery systems. Now, what are their advantages? Several advantages. They are easily administered by the nurse. Need not to go towards physician always. Means administration is quite possible. Easy administration is quite possible. They are easily administered by patient himself. Specialized treatment or specialized person is not required for administration of these ocular preparations. They have quick absorption and effect, less visual and systemic side effects, like in case of conventional ocular preparation, it hampers visual visibility many times. That is not possible with ocular control preparations. Increased shelf life and better patient compliance is quite possible with ocular preparation. Now, apart from, along with these advantages, some disadvantages associated with ophthalmic preparations are the very short time. The solution stays at the surface of your eye. In case of conventional ocular preparation, problem area is that they are not going to ensure prolonged period of contact time. And because contact time is less, drug is getting shorter duration stay over the surface of your ocular sac, and then it drains away from the surface over the surface of cheeks. Due to which, because time of contact is less, it do not get proper amount of absorption, and thereby viability is very poor. Due to which its viability is poor. The instability of dissolved drug, the instability of your dissolved drug, that is another concern, and the necessity of using preservative. The necessity of using preservative is quite problematic in case of ocular sac because it is very delicate organ. So tissues are immediately causing necrosis due to excessive preparation or excessive use of preservative, which is required to maintain efficacy of your formulation. You have to add preservative as an excipient, but that preservative is causing problem to the tissues which are of delicate tissue of your ocular sac. So these are several disadvantages associated with your or ocular drug delivery systems are, they should be sterile. That is why there may be doubt in your mind now that sterility is the particular area which we have discussed in sterile formulation, which are directly injected into systemic circulation. Now here we are just going to instill a drop of your drug or drop of formulation over the surface of ocular sac, and where comes the question of sterility. That's why we have discussed earlier that ocular preparation or ophthalmic products are classified under the other types of parenteral preparation, and whatever quality control tests are mandatory for small volume and large volume formulation, they are also mandatory for other types of parenteral formulation, in which one of the example is ophthalmic product. That's why they should be sterile, they should be isotonic, they should have buffer or tonicity adjustment, that is buffer adjustment or pH adjustment, less drainage tendency, and minimum protein binding. Because more the protein binding, less is the drug available for absorption. These are ideal characteristics for your ophthalmic product. Which are ideal characteristics for ophthalmic products? Sterility, isotonicity, pH adjustment, less drainage tendency, and minimum protein binding. Now, how it is possible for you to reduce drainage tendency? By increasing viscosity of your formulation. By increasing viscosity or by use of novel ocular preparation, you can reduce drainage, thereby more the contact time, more is the absorption, in turn viability. Now, formulation of ocular drug delivery system. Examples, just now we have seen solution or dosage forms are available in ophthalmic products, suspension eye drops are available, emulsion, ointment, eye drops are available. Their advantages and disadvantages. In short, instead of conventional questions, sometimes in examination you may get distinguish advantages and disadvantages of ocular formulation or ocular drug delivery system. So couple of drug delivery system you need to discuss and write their advantages and disadvantages. For example, let us take few examples. In case of solution, what is advantage? Convenience, ease of administration. Anywhere you can see it and you can instill one drop of that particular drug into your ocular sac and you can start your treatment. That is the convenience. For injections, you have to go towards physician. Specialized treatment is required. Say for example, you are going for a knee replacement, you have to go for specific treatment. That kind of high-end skill resource person is not required. Easy and convenient administration is possible. Disadvantages with solution type of ophthalmic preparation is that rapid precorneal elimination and non-sustained action. Rapid precorneal elimination and non-sustained action. Immediately drug rapidly drain away from the surface, and due to which there is no sustained action. Drug, because it moves away from the surface of your ocular sac, there is termination of action immediately. Take example of suspension type of ocular preparation. Suspension ophthalmic product. Patient compliance. Advantages are patient compliance means patients usually prefer best for drugs with low solution or low dissolution. Basically, suspensions are prepared with the drug which are sparingly soluble in water. That's why we are preparing biphasic formulations like suspensions. So best for drug which have low solution, low dissolution. Disadvantages associated with suspensions are drug properties, desired performance, loss of both solution and suspended particles. In case of emulsion ophthalmic product, prolonged release of drug is quite possible, but a disadvantage is that blurring of vision and patient non-compliance is the problem. Because they are O by W or W by O type of emulsions, if you instill such kind of emulsion eye drop, immediately they causes oily surface, and due to which blurring of vision is problematic. Let us take example of ointments, ointment type of ophthalmic formulations. You must have seen some small garlic-like tubes are available in market, in chemist shop. They are called as chloramphenicol. They contain antibiotic drug like chloramphenicol tubes. Those collapsible garlic-like tubes, they contain chloramphenicol, which is antibacterial drug. If you administer that ointment, which contains chloral, it causes sticking of eyelids next day morning whenever you wake up. If during sleep time, if you instill that ointment type of ocular preparation or ointment type of antibiotic, chloramphenicol antibiotic, next day morning whenever you wake up, your eyelids are going to stick to each other. That phenomenon is called as matted eyelids. Matted eyelids means eyelids going to stick to each other. and due to which that looks very dirty sometimes, and because of ocular preparations, conventional ocular preparations. Like this, you can again bifurcate new ocular preparations. New ocular preparation like liposomes, neosomes, nanoparticles, then in situ formulations, lacquer research. You can summarize them in dosage form and you can write the advantages and disadvantages. That will be your homework. Now, recent formulation trends in ocular drug delivery system, ocular control drug delivery system. In short, let us have to start. We have to begin our discussion from conventional drug delivery system. Conventional drug delivery system, in which we should start our discussion from eye drops, which are very much famous and popular since childhood. Many times we have used eye drops, solution eye drops. They are conventional drug delivery system for ocular treatment. In case of eye drop, drugs which are active at eye or eye surface are widely administered in the form of solution, emulsion, and suspension. Various properties of eye drops like hydrogen ion concentration, osmolarity, viscosity, and instill volume can influence retention of solution type of eye drops. Less than 5% of dose is absorbed after topical administration into eye. Through eye drop, why they are replaced rapidly from the market? Because now these are conventional ocular preparations, and these conventional ocular preparations are now set to replace by new ocular preparations, that is NODS, new ophthalmic drug delivery systems. NODS stands for new, N for new, O for ophthalmic, D for drug delivery systems. New ocular drug delivery systems are set to replace these conventional preparations. Why? Because here is the answer: less than 5% of dose is absorbed after topical administration into eye, where remaining 90% of formulation is going, major amount of drug that is spillage over the surface of your cheeks, and remaining amount enters into nasolacrimal drainage, and due to which very few amount or very less amount is available for systemic circulation. The dose is mostly absorbed to the system. Ointments and gels like eye drop, various ointments and gel preparations are also available in conventional ocular preparation. Prolongation of drug contact with the external surface of your ocular sac can be achieved using ophthalmic ointment vehicle. In case of ointments and gels, what is problem associated with solution type of, suspension type of, emulsion type of drug delivery system, or solution, suspension, or emulsion type of ophthalmic product, that they rapidly drain away from the surface. But that problem we have overcome in case of ointments and gels. In case of conventional preparation like ointment, ophthalmic formulation, and gel type of ophthalmic formulation, we have increased contact time. But another concern is blurring of vision and matted eyelids. That is the reason because of which ointments and gel ophthalmic preparation, which are conventional ocular preparation, they also have limited application. आवाज येतोय माझा? Hello?
Yes, sir. You are audible.
Okay. So conventional ocular preparations like solution, suspension, or emulsion type of ocular preparation, and ointments and gels, they have their own advantages and their own disadvantages. More than advantages, they have disadvantages, I will say. Why? Because they do not ensure their proper contact time, and due to contact time is less, they do not ensure proper viability and internal absorption. In case of ointments and gels, we have increased contact time, which is not possible with solution, suspension, or emulsion type of eye preparations. But here, another concern is that blurring of vision and matting of eyelids is the problem. So due to which they are also problematic. Now, ocular inserts and lacquer inserts. Ocular inserts and lacquer inserts. What are ocular inserts? Basically, ocular inserts are also called as occlusor. They are sterile preparations that prolong residence time of drug with controlled release manner, and negligible or less affected by the nasolacrimal drainage. Ocular inserts are sterile preparations that prolong residence time of the drug with a controlled release manner and negligible or less affected by nasolacrimal drainage. Means they will not allow drug to enter in nasal cavity via lacrimal canalically. which are associated with the upper part of your ocular sac. Ocular inserts are available in different variety depending upon their composition and applications. Now, lacriserts. What are lacricert? Is a sterile rod-shaped device. Lacricert is sterile rod-shaped device for the treatment of dry eye syndrome and keratitis sicca, which is infection of your ocular sac. Dry eye syndrome and keratitis sicca. They act by stimulating the Now, second, after conventional ocular preparation, another classification of your ocular formulation is vesicular system. Vesicular system name itself indicates there are somewhat like vessel. Vesicular systems are nothing but they have vessels, and in that vessel you have to incorporate your drug, and after that you have to allow to enter that particular formulation, or you have to replace that particular formulation into the vicinity of your ocular sac, and thereby it increases contact time and in turn improved absorption and viability. Vesicular systems like liposomes, neosomes, lysosomes, they are the some examples, out of which liposomes are biocompatible and biodegradable lipid vesicles, which are made up of natural lipid and about 25 to 1000 nanometer in diameter. They are having an intimate contact with the corneal and conjunctival surface, which is desirable for drug that are poorly absorbed, and the drug with low partition coefficient, poor solubility, or those with medium to high molecular weight, and thus increases the probability of ocular drug absorption. So what is concept of new ocular preparation? That point is starting from vesicular systems. Up till now, whatever point we have discussed, those are conventional ocular preparations. Initially, whatever we have discussed in our previous discuss formulations of your ocular preparation, you start from conventional drug delivery system. In conventional ocular drug delivery system, eye drops, solution eye drops, emulsion type of eye drop, suspension type of eye drop. They have their own advantages and disadvantages, which are summarized here in this slide. Then ointments and gels, which have overcome drawbacks of solution, suspension, and emulsion eye drop, but they have drawback like blurring of vision and matted eyelids, due to which they also have limited application. After that, ocucerts and lacricerts, they are the system which are going to ensure proper prolonged contact time. Another example is vesicular system, which are new ocular preparations, NODS, new ocular drug delivery system, in which you can they are biocompatible and biodegradable lipid vesicles made up of natural lipids and about 25 to 10,000 nanometer in diameter. Now they have an intimate contact with the corneal and conjunctival surface. Intimate and prolonged contact, due to which good absorption and internal viability can be expected with this vesicular drug delivery system, that is liposomes. Which kind of drug can be incorporated, or which kind of drug can be incorporated into this ophthalmic formulation like liposomes? That point is discussed over here. The poorly absorbed, low partition coefficient, poor solubility drugs, they can be used or they can be incorporated into these liposomes, thereby you can allow them to enter into systemic circulations. Now neosomes and discosomes. The major limitation of liposomes are chemical, oxidative degradation of phospholipids, cost and purity of natural phospholipids. Though vesicular drug delivery systems are very much useful for treatment of ophthalmic diseases, they have some drawback of instability. If you have discussed liposomes in your pharmaceutics earlier, you are might aware that liposomes are the vesicular drug delivery system in which you can incorporate both kind of drug, that is hydrophilic as well as lipophilic. That is the beauty of liposomes, but problem is that their instability, because they are bilayer lipid layer. Some amount of portion is available in hydrophilic area and some amount of portion is available in lipophilic area. So the instability, chemical instability of liposomes or vesicular drug delivery system is quite major concern in case of development of ophthalmic product by using vesicular drug delivery system. To avoid these neosomes are developed as means liposomes, because they have chemical instability. We have developed neosomes, which are another improved version of vesicular drug delivery system. Liposomes, neosomes, discosomes, they are also available, or they are the part of vesicular drug delivery system, improved versions of vesicular drug delivery system. To avoid these neosomes are developed as they are chemically stable as compared to liposomes and can entrap both hydrophilic and hydrophobic drugs into the vicinity of their circular structure. They are non-toxic and do not require special handling technique. So neosomes are non-ionic surfactant vesicles that have potential application in the delivery of hydrophobic or amphiphilic drugs. So that is the concept of vesicular drug delivery system that we have discussed. Then controlled drug delivery system. After vesicular drug delivery system, another type of ophthalmic products are controlled drug delivery system, means new ocular preparations. First example is implants. Implants for chronic ocular diseases like cytomegalovirus, that is abbreviated as CMV, retinitis, retinitis. Implants are effective drug delivery system. Earlier, non-biodegradable polymers were used, but they needed surgical procedure for insertion and removal. Nowadays, biodegradable polymers are also available for preparation of implants. Basically, what are implants? Implants are polymeric bag-like structure in which you have to embed your active ingredient, and later on that bag is sealed, and that sealed bag is installed into the surface, into the vicinity of your site of administration. Say for example, this time your ocular sac, so you have to install that implant over the surface of your ocular sac. Say for example, you have to administer that implant subcutaneously, so here you have to insert, take the lesion or lesion of the skin, expose the subcutaneous tissue layer and leave your implant into the vicinity of your subcutaneous tissue, again seal the portion, and thereby it gives its systemic circulation or release of drug into the vicinity of subcutaneous tissue. So implants are basically mean to administer from different location, but because we are discussing ophthalmic product this time, we have to give stress on how they are entering into systemic circulation via ocular sac. So presently, biodegradable polymers such as polylactic acid are safe and effective to deliver drugs in the vitreous cavity and show no toxic signs. So implants are ocular implants are used to treat chronic diseases like cytomegalovirus, retinitis, and implants are very much effective drug delivery system to treat this infection, chronic ocular disease infections. Earlier, biodegradable polymers were available. Now, non-biodegradable polymers are available for preparation of implants. Now, due to recent advances in pharmaceutical technology, biodegradable polymers are like polylactic acid. They are also available for implants. Next type of control ocular drug delivery system is iontophoresis. In iontophoresis, direct current drives ions into the cell or tissues. For iontophoresis, the ions of importance should be charged molecule of the drug. Positively charged drug are driven into the tissue at the anode and vice versa. Ocular iontophoresis delivery is not only fast, painless, and safe, but it can also deliver high concentration of drug to a specific site. What is beauty of iontophoresis that we have discussed over here? Ocular iontophoresis delivery is not only fast and painless, but it also gives improved concentration of drug located into the specific site, and due to which high onset of action is quite possible with the iontophoresis, which are another control or novel ocular preparation. After implant, second type of novel ocular preparation we have discussed, that is iontophoresis. Just with the help of iontophoresis, in case of iontophoresis, direct current drives ions into the cell tissue, and due to this iontophoresis, fast onset of action, painless treatment, and a higher concentration of drug can be accumulated at the particular site, and due to which prolonged contact, thereby prolonged absorption is quite possible with this ocular preparation. Now dendrimers. Dendrimers can successfully use for the treatment of ocular administration. They are another examples of vesicular drug delivery system. Microemulsion. Microemulsion is the dispersion of water and oil stabilized using surfactants and co-surfactants to reduce interfacial tension and usually characterized by small droplet size up to 100 nanometer. Higher thermodynamic stability and clear appearance. That is another advantage associated with microemulsions. Now, in case of microemulsions, how they differ from emulsions? Their state of subdivision is up in nanometers, in nano size. Due to their small droplet size, they causes rapid penetration from the ocular surface, and thereby they give rapid onset of action or viability and improved absorption in case of sparingly soluble drug delivery systems or sparingly soluble active ingredients. Selection of aqueous phase, organic phase, and surfactants, co-surfactant systems are critical parameters which can have effect on stability of the system. After microemulsion, another type of ophthalmic formulations are nanosuspensions. Nanosuspensions have emerged as promising strategy for the efficient delivery of hydrophobic drugs because they enhance not only rate and extent of ophthalmic drug absorption, but also the intensity of drug action with significant extended duration of drug effect. Next type of control ocular preparations are microneedles. Microneedle had shown prominent in vitro penetration into sclera and rapid dissolution of coating solution after insertion, while in vivo drug level was found to be significantly higher than the level observed following topical drug administration like pilocarpine. Now, microneedles are nothing but microneedles have shown prominent in vitro penetration into sclera and rapid dissolution of coating solution after the insertion, while in vivo drug levels was found to be significantly higher. Because of their microstructure or microstate of subdivision, they give rapid penetration, thereby higher the level of drug administration or drug penetration is quite possible with these microneedles. Mucoadhesive polymers, they are basically macromolecular hydrocolloids with plenty of hydrophilic functional groups such as hydroxyl, carboxyl, amides, sulfates, having capability of establishing electrostatic interactions. Now, in case of mucoadhesive polymers, many polymers, there is one layer called back-end layer of your ocular sac, that is mucin, that we have shown in this previous instant picture. Here you can see here outermost layer of your ocular sac is tear fluid, that is lipid layer. Second layer followed by lipid layer is aqueous layer, which is conjunctival layer, and after that there is layer like mucin, and several polymers which have capability to bind this mucin, they are called as mucoadhesive polymer. The polymer which has ability to bind with this mucin, that phenomena is called as mucoadhesion, and polymers are called as mucoadhesive polymers. So such kind of polymers, due to their adhesion or viscosity, they remain in contact with this ocular sac for prolonged duration. The problem with solution, suspension, or emulsion hydrop is that they rapidly drain away from the surface. Due to their less contact time, they give less viability and less absorption. But here, in case of mucoadhesive or control ocular preparation, like mucoadhesive polymer, because of their viscosity, they remain bind with the mucin layer for prolonged duration. Thereby, they remain contact with your ocular sac for prolonged duration. More the contact time, more the absorption, more the viability. That is the outcome of this control ocular preparation like mucoadhesive polymer. In all example which we have discussed so far, implants, iontophoresis, dendrimers, microemulsions, nanosuspensions, microneedles, mucoadhesive polymers, the moral of the story is that so far whatever either you go and play with the physical and chemical property, or you increase corneal contact time or conjunctival contact time, due to which more the contact time, more is the residence, more is the viability, more is the absorption. That is the concept of formulation and development of ocular drug delivery system. Now another example, after conventional, novel, vesicular and controlled ocular preparation, fourth type of ocular formulations are particulate formulations. Examples of particulate drug delivery systems are nanoparticles and microparticles. Now classification of inserts. There is one point mentioned in your syllabus, that is inserts, ocular inserts. So they can be classified in terms of non-erodible inserts and erodible inserts. If you will get question in this area that explain in detail ocular inserts, so you have to classify them based on their erodible nature. They may be erodible inserts and they may be non-erodible inserts. Non-erodible inserts are classified further as ocuserts and contact lenses, and erodible inserts are classified further as lacriserts, SODI. SODI means soluble ophthalmic drug insert. It is a short form. SODI stands for soluble ophthalmic drug insert, and then mini disc. So if you want to classify inserts or ocular inserts, you have to classify them under two broad headings, that is non-erodible inserts and erodible inserts. In case of non-erodible inserts, they are further classified into ocuserts and contact lenses. Later on, again, these are major points of discussion. We can separate discuss the ocuserts, we can separate discuss the contact lenses, what are basically erodible inserts, lacriserts, soluble ophthalmic drug inserts, and mini disc. But because our time span is limited and in on undergraduate level, as far as the syllabus is concerned, this precise classification is very much enough. If you want to classify inserts, you classify them based on these two broad broad sub areas: non-erodible inserts like ocuserts and contact lenses, and erodible inserts like lacriserts. SODI means soluble ophthalmic drug insert, and mini disc. Now, non-erodible insert like ocuserts. What are basically ocuserts? You all are very much aware. To any ocusert, there are three components: upper layer, inner layer, and ring, impregnated ring, or that shape retaining ring. Upper layer, that is made up of EVA polymer. Bottom layer is made up of EVA polymer. आवाज येतो सर? हॅलो.
हा सर, आवाज येतोय तुमचा.
ओके.
हा हा
सर, आपल्याला कधीपर्यंत संपवायचं असं काही नाही ना?
नाही, आफ्टरनून 12:30 ला दुसरा लेक्चर हे केलेलं आहे सर.
बरोबर, चालेल. 15 मिनिटात आपण वाइंड अप करू शकतो. ओके.
येस सर, येस.
ओके सर. Non-erodible insert, in that first point of our discussion is ocuserts. Ocusert, it is a therapeutic system, therapeutic ophthalmic preparation, which is flat, flexible, and elliptical device. It is flat, flexible, and elliptical device. It has flexibility due to EVA polymer, and it is elliptical in nature because of the eye shape of your ocular sac is concerned. Now, elliptical device designed to be placed in the interior cul-de-sac between the sclera, interior cul-de-sac pouch between the sclera and eyelid, and to release pilocarpine continuously at a steady rate of 7 days. Now, what is concept of cul-de-sac? Cul-de-sac pouch is the particular area or anatomy and physiological phenomena in which it is a bag-like structure which has only one opening. So your ocular sac is cul-de-sac pouch. Wherever such kind of phenomena is available in our body, it is referred to as cul-de-sac pouch. Cul-de-sac means it is a pouch-like structure which has only one opening, like our wallet or like our purse. It is sealed from all three ends and it has only chain from upper side. So that is the opening. That same scenario happens with our ocular sac. It is closed from the front and anterior part. It has just opening towards the optic nerve. That's why it is called as cul-de-sac pouch, or that cul-de-sac between the, and location of administration of ocular insert is in between the sclera and this cul-de-sac pouch, eyelids. Between cavity is called as cul-de-sac pouch, whereby you can administer pilocarpine, Pilo 20 or Pilo 40 formulations are available in market, and that releases pilocarpine at a continuous rate for 7 days, 20 to 40 microliters microgram of drug per hour for not less than 7 days. The device consists of three layers: outer layer, inner core, and a retaining ring. Any occlusal system contains outer layer, inner core, and air-shaped retaining ring. Here they have shown this particular phenomena. First, the names which are given 1, 2, 3, and 4. 1 is your outer layer, 4 is your inner layer, and 2 and 3 are there. 2 is your ring. In between 3, that is your drug core that is going to capture. 1 is outer layer, 4 is your inner layer, 2 is your a retaining ring, shape retaining ring, and 3 is your drug core that is going to capture into the vicinity of this ring, and later on to this ring, this vapor-like structure of your 1 and 4, that is inner layer, outer layer, and inner layer, they are going to inserted into this shape retaining ring. That ring is made impregnated with titanium dioxide, ring of EVA. It is ethyl vinyl acetate that is impregnated with titanium dioxide. The occlusal available in two forms, Pilo 20 and Pilo 40. Difference is that 20 microgram per hour and Pilo 40 is going to release not less than 40 microgram per hour of drug. Now, advantages of occlusals: reduce local side effect and toxicity, around the clock control intraocular preparation, improved compliance. Disadvantage: retention in eye for full 7 days. Retention in eye for full 7 days. Periodical check of unit is required. Replacement of concomitant unit, and it is expensive treatment. Now, contact lenses. Another type of non-erodible inserts are contact lenses. These are occlusals and contact lenses. They are examples of non-erodible inserts because they are not going to allow erosion of the surface, and they only become permeable to body fluid, and thereby fluid enters and interacts with your core of drug, and thereby concentration, metered amount of drug is going to release from the permeable surface. That's why they are called as non-erodible type of inserts. In case of erodible insert like lac inserts, mini disc, soluble ophthalmic drug insert like SODI, there is erosion of surface polymeric layer, thereby entry of fluid and exit of meter amount of dose of drug. That is quite possible. That's why they are placed into the category of erodible inserts. Means erosion is possible. Here erosion is not possible. That is the distinguishing feature of erodible and non-erodible insert. In case of contact lenses, these are circular shape structures. Dyes may be added during the polymerization, and drug incorporation depends on whether their structure is hydrophilic or hydrophobic in nature. Advantages and disadvantages of your contact lenses: no preservation is required. Size and shape, they are the advantages. Various sizes and shapes are available. Disadvantage of contact lenses: handling and cleaning is quite troublesome. They are expensive mode of treatment. Now, erodible type of inserts, in which we have discussed lac inserts, soluble ophthalmic drug insert, and mini disc. They are examples of erodible inserts. The solid inserts absorbs the aqueous tear fluid and gradually erode and disintegrate. What is mechanism of drug absorption via erodible insert? The solid inserts, erodible inserts are solid inserts, absorb the aqueous tear fluid upon installation into ocular sac. They absorb tear fluid and gradually start erosion, and thereby they disintegrate, and then liberation of drug is possible over the surface of your ocular sac, that is cul-de-sac pouch. The drug is slowly leach from the hydrophilic matrix. They quickly lose their solid integrity and are squeezed out of the eye with eye movement and blinking. They do not need to remove at the end of their use, because they erode and thereby they go on degrading itself from the surface of administration or from the site of administration. Due to which, in case of contact lenses and occlusal, removal and insertion is the problematic concern. For that, you need specialized person to approach for the treatment of that particular ophthalmic product. But here, in case of erodible insert, after installation, there is no removal is not required, because they erode and disintegrate from the location of administration. Examples like research, soluble ophthalmic drug inserts, that is SODI, and mini discs. What are lac research? They are rod-shaped device made up of propyl cellulose without any preservative. What are soluble ophthalmic drug inserts? They are soluble ocular drug inserts. Small oval vapor they are small oval vapor-like structure, sterile thin film of oval shape that is weigh about 15 to 16 milligram, and it is mostly used in the glaucoma, that is for the treatment of ocular blood pressure treatment. Now mini disc, they are counter disc with the convex front and back surface. Diameter of mini disc is around 4 to 5 millimeter. Composition is silicon based pre-polymeric alpha type device. Up till now, whatever points we have discussed conventional ocular preparation. Conventional ocular preparation like solution, emulsion, suspension type of eye drop, ointments, gels, ocular inserts, and lac inserts. Then new ocular preparation like vesicular drug system, in which we have discussed liposomes, neosomes, discosomes. Then we have discussed control ocular preparation like implants, iontophoresis, dendrimers, microemulsions, nanoemulsions, nanosuspensions, microneedles, mucoadhesive polymers. Then particulate drug delivery systems for treatment of ophthalmic formulation of ophthalmic product like nanoparticles or nanoparticles which are used for the treatment of ophthalmic products, ophthalmic infections. Then inserts, classification of inserts, non-erodible inserts and erodible inserts. In non-erodible inserts, we have learned what are occlusers, what are contact lenses, which are non-erodible in nature. Insertion and removal is required. Erodible inserts, insertion is required, removal is required due to their disintegration. Lac inserts, soluble ophthalmic drug inserts and mini discs, they are the examples. After that, there is one point of evaluation of ocular drug delivery system. That is the particular, you have to evaluate ocular preparation based on their thickness of film, drug content uniformity, uniformity of weight, percentage moisture absorption by your ocular film. For in vitro evaluation, bottle method, diffusion method, modified rotating basket method, modified rotating paddle apparatus, they are available. So with this, we are supposed to conclude with our ophthalmic preparation. Ophthalmic preparations are their type of site-specific drug delivery system. Thereby, major point of discussion is that in case of conventional ocular preparation, time of contact is less, they rapidly drain away. That's why absorption and bioavailability is less. In case of novel ocular preparation, we have increased contact time, due to which there is rapid absorption and more the bioavailability. If you have any doubts, you can ask me. Hello, sir. हॅलो हॅलो हां सर, आवाज येतो माझा? हॅलो.
येस सर, आवाज येतोय.
ओके सर.
हां, थँक्यू सर.
इव्हॅल्युएशन मेथड्स नाही घेतलं सर मी आता. इव्हॅल्युएशन
no.
मेथड्सचे फक्त पॉइंट सांगितले त्यांना.
Okay, sir. If possible, sir, in next session or next month, we will arrange another one.
Another lecture. No problem, sir.
Okay, sir.
We can continue this topic again in, or we can deal with new topic again.
Oh, okay, sir. Thank you, sir.
Okay, thank you. Shall I stop sharing, sir? If students have any doubt, they can ask me, sir.
In a chat section, there is a there is no any question, sir. Sir, you have explained very nicely and
Yes.
very
you,
informatively, so that all
Thank
students get the all informations. If any students have any query or questions, I will personally ask them, and I will
My pleasure,
share with
sir.
you.
No problem. Anytime you can ask me, and I am happy to share my knowledge.
Okay, sir.
Thank
Sir,
you
first
very
of all,
much,
thank you, sir, for accepting our invitation as a guest lecturer. And also, sir, on the behalf of our principal, Dr. Sunil Nirmal, sir, as well as the Honorable Sri Baban Rao Pachpute Vichardhara Trust, Group of Institutions, College of Pharmacy, Kasti, I am thanking you for delivering such informative, interesting lecture to our students. Definitely, our students get benefited with that informations. Thank you, sir.
Thank you very much, sir. Thank you, Ganesh. I would like to extend my gratitude towards Principal of Parikrama College, Dr. Nirmal sir, Professor Jaideep Pawar sir, Wagmode sir. Thank you very much, sir, for giving me such nice opportunity to interact with your students. See you again, sir. Thank you very much.
Thank you, sir. Here we will
Thank you.
stop our this session, sir. Thank you,
Thank
sir.
you, sir. Thank you. Good day, sir.
Good day, sir.